Part A Medicare costs are on the rise again. Today we're discussing what Part A of Medicare covers and the cost for 2025. These are important facts and figures for this year you need to stay up to date with. My name is Woody. I'm with the local plug, and for over a decade now, I've been educating and serving people of all walks of life throughout the nation for their insurance needs. So let's dive in. Part A of Medicare, simply put, is hospital insurance, meaning it covers you when you go to the hospital. For most people, it is premium free if they have worked at least 10 years and met the 40 quarter requirement. The costs like deductibles and copays, however, increase annually, which is why we provide these outlines to keep you guys up to date. This year's deductible is up to $1,676. That is the cost you pay before the insurance kicks in. This deductible operates off a 60-day benefit period, so let's explain it like this. Say you left a wet towel on the edge of the bed again and mama finds it and she's mad because she's told you 1,000 times not to do this before, and she gives you the good old 1-2 combo, landing you in the hospital and you're concussed. Boom, you owe that $1,600 deductible. Now, a few days goes by and they send you home because you've gotten better and you've learned your lesson. But a month later, you leave the toilet seat up in the middle of the night and your wife finds herself swimming. So she has to teach you another lesson. Again, back into the hospital. Well, guess what? No deductible this time because you've already satisfied that deductible for that 60-day window. Now, this next part is rare, but it could happen. So let's explain what the costs are if you're in the hospital for more than 60 days. Starting days 61 through 90, you will begin to pay a daily copay of $419 per day. If you're still in the hospital, starting days 91 through 150 goes to $838. After 150 days in the hospital, guess what? You're on the hook for the whole bill. Medicare aid does cover some skilled nursing care, but it requires a 72-hour inpatient hospital stay first. Both the hours and the type of stay are the requirement to have that paid. So if you meet those requirements, the first 20 days are covered 100%, which is great. However, days 21 through 100, Medicare wants you to pony up and pay $209.50 a day. After 100 days, Medicare quits paying. Let's be clear, Medicare is not long-term care coverage. Now, Medicare also covers some home health care if it's typically 35 hours or less or 5 days or less a week. Lastly, is hospice care. Medicare will cover hospice 100%. Now, folks, this is a very high-level overview of how Medicare A is currently working for 2025. I could take 100 people and get 100 different situations. So if you would like a more personalized idea of how it could work and what's the best course of action for you, get a hold of us so we can help. Stick around for parts B, C, and D to get the full scoop on Medicare for 2025. Thanks for watching.